safety practices are verify care or order for the client, perform hand hygiene before and after any client care or when handling supplies, verify facility policy and procedure and assemble required equipment, consult manufacturer's recommendation when any equipment is used, knock on client door, identify client using 2 forms of identification, note overall condition of the client, elevate bed to promote good body mechanics, explain the procedure to the client and provide for privacy, don PPE if indicated. Once completed, lower the bed, raise the side rails according to the care plan, and ensure that the call system is within reach. If any abnormal findings are present, you want to notify your charge nurse immediately. And with any IV pushes, you need to ensure that your clinical professor is present. So for blood administration, first you want to verify the healthcare provider's order for the blood or blood product being administered, date and time to begin the transfusion, duration of the transfusion, as well as any medication that needs to be administered before or after, such as Benadryl or Lasix to remove that excess fluid off. Some blood products that can be administered are packed red blood cells, washed red blood cells, platelets, plasma, and white blood cells. You want to ensure that you obtain the type and cross-match every 72 hours. Then you're going to obtain the consent form and put it in the client's record according to the policy and procedure of the facility. And then you're going to assemble the administration set, prime the tubing with normal saline, and use the filtered tubing required. And then you're going to obtain venous access using a large gauge needle such as the 18 or 20 gauge. Then you're going to obtain baseline vital signs and labs such as hematocrit, hemoglobin, coagulation, and platelets, and ensure that it gets put into the client's record or the EMR system. And then you're going to assess urine output, skin color, and assess if they've had any previous transfusion reactions or allergic reactions. And then you're going to verify the patient's name, identification number, blood label, compatibility, expiration date, and labs with another RN. And then you're going to agitate the blood sample, the blood for any abnormalities such as blood clots or cloudiness, which could be a sign of infection. And then you're going to initiate transfusion according to the policy and procedure. Once a transfusion has begun, you want to remain with the patient for the first 15 minutes to observe for any adverse reactions such as chest pain, shortness of breath, or itching. And it's recommended that you take their blood pressure every 5 minutes for that first 15-minute interval. After the 15 minutes, you can increase the flow rate according to the plan, and you want it to be done within 4 hours. However, take special note for the elderly patients as their transfusion rates may need to be a slower rate. You want to obtain and record vital signs at the prescribed intervals. You also want to observe how they tolerated the transfusion and record that into the record. And then always use the recommendations of the manufacturer when using any of their products.